Mayor, licensed clinical social worker, and today we're talking about panic attacks. Now, panic attacks are really common. They actually affect 11% of the population in the US. And you may have experienced a panic attack before or know somebody who has experienced a panic attack. Now, panic attacks usually only last a few minutes, but they are very, very intense and extremely uncomfortable. There are many different symptoms that can happen during a panic attack, and it can be a little bit different for each individual person. So some of the symptoms of panic attacks are a very intense fear that lasts for about a few minutes, and then it will go away. Individuals may have heart palpitations. Their heart may be racing very fast and maybe just pounding rapidly in their chest. They may be experiencing sweating. They might be experiencing trembling or shaking. They may have shortness of breath. It might feel like they're choking. They may be experiencing chest pain. They might have nausea or just any kind of GI symptom, like just pain in their stomach, feeling like they really need to go to the bathroom immediately. They might feel dizzy, or they may feel like they're gonna faint or pass out. They may have chills, numbness, tingling, sort of a detached feeling from life, or a depersonalization feeling like they're not really there. They might also have a fear of dying, losing control, or also feel like they're going crazy. And so these symptoms, which, are different for each person, they do describe what a panic attack is. Panic attacks can happen with triggers. It may happen in only certain situations where the person feels very anxious, so then the panic attack happens. But also panic attacks can be random. Somebody may be just in a very calm place. They might not be experiencing much anxiety, and then all of a sudden they're having a panic attack. So panic attacks are very scary because it is confusing. Sometimes people think they might be having a heart attack. They think they may be dying. A lot of times people will go to the emergency room, but then it ends up that the doctor says that it's actually just anxiety, and there's actually nothing wrong with their heart. So panic attacks are very confusing sometimes, and just very distressing because you're not really sure what's going on with your body. It can also be a huge problem if panic attacks are just occurring randomly. So maybe somebody is out driving and they're having a panic attack. So then they have the added fear of, how are they going to drive properly and make sure they don't get into an accident when they're experiencing this intense panic attack. Some clients might have panic attacks at work or at school. And then that can be very difficult. And so even though about 11% of the population just has experienced panic attacks, if the person is having panic attacks and also has a fear that has lasted for 1 month or longer of having future panic attacks and is starting to engage in behaviors of avoidance. So if you have those added symptoms, that's where it really turns into what's called panic disorder. So panic disorder is somebody that's had a panic attack and now they're avoiding those situations. And now they are very worried about having a future panic attack. And so it's now causing distress and it's causing impairment in their life. And they're not able to function in the way that they used to function before they had the panic attack. So for panic disorder, for example, the individual might be avoiding school. They may be calling out sick to work because they think maybe a panic attack might be occurring. The individual may stop driving because they're so worried about having a panic attack in the car. There are lots of different things that the person might start avoiding. So for panic disorder, the individual has an association between where the panic attack occurred or the circumstances around the panic attack, and now they're actually starting to change their behavior and avoid those places in order to them to prevent the panic attack from happening. And that's their way of trying to cope with the symptoms. And it is understandable that would be kind of a logical thing that somebody might do, if you're having a panic attack, when you're at school, then you might not want to go to school. And that is actually a pretty logical thing. But in therapy, what we do is we try to challenge the client to really break that down and explain to them that that's not really a good way to function in your life. You can't just avoid every situation that's ever occurred, when you did have a panic attack, because then you're not really going to be able to function properly. So we typically do cognitive behavioral therapy to try to challenge some of these beliefs and to really encourage the individual to go ahead and face their fears. If they've stopped driving, we work with them to try to get them back into driving, to try to get them back with going to school or to going to work, or if they have panic attacks in social situations, to go ahead and still engage in those social situations, not to just avoid it and accept that that's just the way their life is and that they have to live without doing these activities that, would make their life so much better. So another thing that we do in therapy sessions is we really work with the client to explain and give them the proper education about panic attacks. And panic attacks do typically only last for a few minutes. And even though they're very uncomfortable, they're distressing, and they're scary, people do not die from panic attacks. There is actually no harm that can occur. So when in session, I like to explain to the clients that I know that this is very scary for them, and I know they're really afraid of having a panic attack. But the reality is that they're not going to die. They're not going to pass out. It's very unlikely that people pass out from panic attacks. It is almost impossible that is going to happen. And panic attack is not a heart attack. There are differences. So we can explain more about that in the session so that they get really good at identifying, hey, you know what? I'm actually experiencing a panic attack right now, and it is extremely uncomfortable, but it is not going to kill me. And in fact, in a few minutes, it's actually going to go away. So that is really a key thing that we work on, providing that education to clients in sessions so that they get so good at just identifying what is going on. Because I think the worst part about having a panic attack is that it is very confusing and you don't know what's going on. You're not really sure what to do. So if we can provide that education and work with a client on identifying, what are triggers that typically happen during the panic attack, or what kinds of symptoms typically happen first, because that's going to be different for each person, because everybody's panic attacks look a little bit different. So we work with the client just on providing, assessment and the tools to help them really become like their own therapist so that they can really identify what's going on with their body. And by doing that, they begin to not be quite so afraid of having the panic attack, because they can feel a little bit more confident in understanding what's going on in their body and that it's not going to hurt them and it will actually go away. And that is usually very helpful with my clients with panic attacks, is just really spending a lot of time discussing that there's really not actually any danger to having a panic attack and that they will be okay if they can just wait it out. We also work on tolerating symptoms. So if we can get the client better at tolerating these distressing symptoms and working on just acceptance, that is very helpful. And that will actually reduce their overall anxiety about having a panic attack in the future, because now they can say that if they have a panic attack, they are now able to cope and they do not have to just avoid the situations. They can actually, go to school, go to work, go drive a car, and if they have a panic attack, they now know what to do. Another thing that we work on is slow, deep breathing, teaching the clients the effective way to breathe during a panic attack, because typically when people are afraid, they begin to hyperventilate. And that is the absolute worst thing to do during a panic attack, is to hyperventilate. You've got to just do some slow, deep breathing, make sure your body is getting enough oxygen, and that will help the panic attack to go away. So we work on that in session, explaining to the clients how to properly breathe through the panic attacks. And lastly, another technique that is very helpful with panic attacks is what's called grounding techniques. There are several different grounding techniques. I have many worksheets, and what I do with my clients is I like to send them lots of different ideas for grounding techniques. And I encourage them just to go ahead and give them a try, because the one that works for them might not be the same one that works for a different client, because everybody's different. Everybody has a different personality. And so depending on their personality, their beliefs, their situation, maybe what type of job that they hold, there might be one grounding technique that they really like better compared to the others. So I like to go over these different grounding techniques with my clients, and I like to send them handouts and just encourage them to give them a try. And I tell them, hey, you know what? This week, we really need you actually to have a panic attack, because if you never have a panic attack, we can't try out some of these grounding techniques. And I always tell my clients, I know you're not going to like what I'm about to tell you, but I need you to practice. If you don't practice, you can't get better. So really need you to be anxious this week and then try out the grounding technique. And I tell my clients, I need you to be a detective. I need you to try these grounding techniques, and I need you to report back to me and let me know which ones you liked and which ones just you didn't like, they didn't work for you, and you don't want to try them again. And pretty much all of my clients with panic disorder, typically, they end up trying out the grounding techniques, and they will find that one that they really like. And they will tell me, Kelly, this is the one. This is the one that works. And once you found one, that's all you really need, is just the one grounding technique. If you want to try out more, you can, but you just need one thing to do when you feel like a panic attack is coming on. And so when I work with my clients, that's what we work on. And they do always end up finding that one grounding technique that works for them. And typically the panic attacks will begin to go away, because once you have things in your toolkit and you know what's going on in your body, there's really no reason to continue being so scared, because you can say to yourself, if I have a panic attack, I now know this one grounding technique that will work, and there's really no reason for me to avoid all these situations. So I would say pretty much that's an overview of panic attacks, panic disorders, and how we treat them. And, it is unfortunate that so many people have panic attacks and don't really know what to do. So I would just encourage you, if that sounds like you or someone just reach out, find a therapist that can work with you and that can help you with some of these things, because there's really no reason to just suffer for all these years when there is effective treatment out there for panic disorder.